You just finished your ACL surgery. Things are getting better, you're moving around more, pain is decreasing, but you have this big ugly scar on your knee and you want it to go away. Is there anything you can do? Well, the type of surgery you had actually can affect the type of scarring you'll have. The smaller the incision the surgeon made on your knee, the smaller your scar is going to be. Wound management is also incredibly important. Directly managing and treating any infection can impact how well your scar is going to heal. Another thing to look out for is hypertrophic scarring. This is more thick, raised, red scars that usually appear around the 3-month mark following surgery. Now, the age-old question, can I buy any ointments or creams to reduce my scarring? Unfortunately, the evidence behind a lot of the products out there is quite poor and don't really back up its use. So, will your scar ever completely go away? The answer is no. An ACL scar will not completely disappear. However, following the steps mentioned above will help you to improve and ensure the best healing possible for your incision.